CCR, that is criticize, correct, and rewrite a prescription. Usually the prescription is given the wrong prescription. Either the drug is wrong, the dosage, duration is wrong, where we have to criticize the prescription which is given in a wrong way. We have to criticize that prescription, correct that prescription, and rewrite the prescription. When we are rewriting that prescription which is false, we are writing in a correct format. We have to follow the prescription format. When you are rewriting again the corrected prescription, we have to follow and write the correct prescription format. It is again that place, date, patient details, doctor details, superscription, and inscription, subscription, transcription or signature, and then the later doctor initial with stamp or with registration number. We call it as CCR, that is criticize, correct, and rewrite. First question: analyze, correct, and rewrite the following prescription for a case of pulmonary tuberculosis with secondary staphylococcal infection. This CCR also we have to write in a clinical pharmacology record. So I'll be dictating very slowly. We'll be writing neatly in the records. Analyze, correct, and rewrite the following prescription for a case of pulmonary tuberculosis with secondary staphylococcal infection. It is given gentamicin 2 grams given orally per day, vancomycin 500 mg every 6 hourly, INH, that is isoniazid 600 mg per day, ethambutol 200 mg per day. So like this, there will be prescription will be given. It is a false prescription. It either the drug is wrong, whether high dose or low dose. All this, everything is felt wrong. We have to criticize, correct, and rewrite in the prescription format. Coming to the criticism, gentamicin, it is an aminoglycoside antibiotic. It is an aminoglycoside antibiotic effective against gram-negative organisms, but not against Mycobacterium tuberculosis. Gentamicin is an aminoglycoside antibiotic effective against gram-negative organisms, but not against Mycobacterium tuberculosis. The dose mentioned here is very high, and route of administration is not correct. The dose mentioned here is very high, and route of administration is not correct. These are polar compounds. These are polar compounds and are not observed from gastrointestinal tract and are not observed from GIT. Hence, they are given parenterally. Hence, they are given parenterally. Gentamicin, it is an aminoglycoside antibiotic effective against gram-negative organisms, but not against mycobacterium tuberculosis. The dose mentioned here is very high and the route of administration is not correct. These are polar compounds and are not observed from GAT, hence they are given parenterally. Vancomycin, it is a glycoprotein antibiotic. Vancomycin is a glycoprotein antibiotic, not effective against mycobacterium tuberculosis, not effective against mycobacterium tuberculosis, but it can be used to treat staphylococci infection. Vancomycin is a glycoprotein antibiotic, not effective against mycobacterium tuberculosis, but it can be used to treat staphylococci infection. Vancomycin causes ototoxicity, nephrotoxicity when given along with gentamicin. Toxicity is very high. Vancomycin causes ototoxicity, nephrotoxicity. When vancomycin is given along with gentamicin, toxicity is very high. We can use other safe drugs against staphylococcal infections. We can use other safe drugs against staphylococcal infections like methicillin or cloxacillin in a dose of 2 grams per day. Methicillin or cloxacillin in a dose of 2 grams per day. Isoniazid, it is the first line of drug for the treatment of tuberculosis. The dose mentioned here is very high. The usual dose of INH is 300 mg per day. Isoniazid is the first line of drug for the treatment of tuberculosis. The dose mentioned here is very high. Usual dose of INH is 300 mg per day. Ethambutol, it is the first line of drug for the treatment of tuberculosis. The dose mentioned here is too lower dose. The normal dose of ethambutol is 800 mg per day. Ethambutol is the first line of drug for the treatment of tuberculosis. The dose mentioned here is too lower dose. Normal dose of ethambutol is 800 mg per day. Correction. Capsule rifampicin 600 mg OD for 4 months. Capsule rifampicin 600 mg OD for 4 months. Tablet isoniazid 300 mg OD for 4 months. Tablet isoniazid 300 mg OD for 4 months. Tablet ethambutol 800 mg OD for 4 months. Tablet ethambutol 800 mg OD for 4 months. Tablet pyrazinamide 1500 mg OD for 4 months. Tablet pyrazinamide 1500 mg OD for 4 months. Tablet methicillin 500 mg QID for 7 days. Tablet methicillin 500 mg QID for 7 days. Rewrite. Under the heading rewrite, we will write the drugs in the prescription format, that is date, place, patient details, doctor details, so prescription, drugs, and at the end initial with registration number. Here, whatever the corrected prescription drugs, same drugs will write again. So the capsule rifampicin, 600 mg OD for 4 months. Tablet isoniazid, 300 mg OD for 4 months. Tablet ethambutol, 800 mg OD for 4 months. Tablet pyrazinamide, 1500 mg OD for 4 months. Tablet methicillin, 500 mg QAD for 7 days. Second question. Analyze, correct, and rewrite. Analyze, correct, and rewrite the following prescription. The following prescription for a case of rheumatoid arthritis associated with diabetes mellitus. Rheumatoid arthritis associated with diabetes mellitus. Here it is given phenylbutazone 50 mg once a day. Phenylbutazone 50 mg once a day. Tolbutamide 100 mg once a day. Tolbutamide 100 mg once a day. Soluble insulin 50 units a day. Soluble insulin 50 units a day. Analyze, correct, and rewrite the following prescription for a case of rheumatoid arthritis associated with diabetes mellitus. Phenylbutazone 50 mg once a day. Tolbutamide 100 mg once a day. Soluble insulin 50 units a day. Criticism. Phenylbutazone, it is a NSAID, non-steroidal anti-inflammatory drug used in the treatment of acute rheumatoid arthritis. Phenylbutazone is NSAID used in the treatment of acute rheumatoid arthritis. Here the dose and the frequency is too low. Here the dose and frequency is too low. Normal dose of phenylbutazone is 100 mg TAD. Normal dose of phenylbutazone is 100 mg TAD. Phenylbutazone is a drug which displaces the oral hypoglycemic agents. Phenylbutazone is a drug which displaces the oral hypoglycemic agents, that is tolbutamide, from protein binding site, and hence enhances its action, causing severe hypoglycemia. Phenylbutazone is a drug which displaces the oral hypoglycemic agent, that is tolbutamide, from protein binding site, and hence enhances its action, causing severe hypoglycemia. Tolbutamide, it is an oral hypoglycemic agent with short duration of action. Tolbutamide is an oral hypoglycemic agent with short duration of action. The correct dose of tolbutamide is 250 to 500 mg TAD. The correct dose is 250 to 500 mg TAD. The better alternative drug in the above case is second generation sulfonylurea, that is glibenclamide. The better alternative drug in the above case is second generation sulfonylurea, that is glibenclamide. Glibenclamide is used in a dose of 2.5 to 5 mg OD, and it can be increased maximum up to 10 mg OD. Glibenclamide is used in a dose of 2.5 to 5 mg OD and increased maximum up to 10 mg OD. Insulin is used parenterally and in emergency conditions like diabetic ketoacidosis. Insulin is used parenterally, and in emergency conditions like diabetic ketoacidosis, here the dose given is too low, and oral hypoglycemic agent along with soluble insulin is not necessary in the case of diabetes mellitus. Oral hypoglycemic agent along with soluble insulin is not necessary in case of diabetes mellitus. Insulin is used parenterally and in emergency conditions like diabetic ketoacidosis. Here the dose given is too low, and oral hypoglycemic agent along with the soluble insulin is not necessary in case of diabetes mellitus. Correction: injection insulin 30 units subcutaneously BD before meals. Injection insulin 30 units subcutaneous BD before meals. Tablet phenylbutazone 100 mg TID. Tablet phenylbutazone 100 mg TID. Rewrite the prescription. This you should write in the prescription format. The treatment section, you write injection insulin 30 units subcutaneous BD before meals. Tablet phenylbutazone 100 mg TID. Third question, criticize, correct, and rewrite the following prescription for a case of acute bronchial asthma. Criticize, correct, and rewrite the following prescription for a case of acute bronchial asthma. Here it is given adrenaline 0.5 mg IV, adrenaline 0.5 mg IV, salbutamol 2 mg TID orally, salbutamol 2 mg TID orally, chromoline sodium 20 mg BD orally, chromoline sodium 20 mg BD orally. Criticism: adrenaline is an adrenergic agonist and may be used in acute attacks of asthma. Adrenaline is an adrenergic agonist and may be used in acute attacks of asthma. It is never given IV as it may cause cardiac arrhythmias. Adrenaline is never given IV as it may cause cardiac arrhythmias. Adrenaline is given subcutaneously in a dose of 0.205 mg in 1:1000 dilutions. Adrenaline is given subcutaneously in a dose of 0.2 to 0.5 mg in 1:1000 dilutions. Salbutamol is a selective beta-2 agonist used in acute attack of bronchial asthma. Salbutamol is a selective beta-2 agonist used in acute attack of bronchial asthma. In inhaler form, in a dose of 100 microgram per puff, 100 microgram per puff for every 15 to 20 minutes, until the symptoms subside. It is used for maintenance therapy. In the form of tablets with a dose of 2 to 4 mg per day orally. It is used for maintenance therapy. Salbutamol is used for maintenance therapy in the form of tablets with a dose of 2 to 4 mg per day orally. Cromolyn sodium is a mast cell stabilizer. Cromolyn sodium is a mast cell stabilizer. Prevents release of histamine from the mast cell. Prevents release of histamine from the mast cell. It is used for prophylaxis and not for the treatment. Cromolyn sodium is used for prophylaxis and not for the treatment. It is used in the form of powder in inhaler in a dose of 20 mg per puff. Cromolyn sodium is used in the form of powder in inhaler in a dose of 20 mg per puff. Correction. Injection adrenaline 0.5 mg subcutaneous 1:1000 dilutions. Injection adrenaline 0.5 mg subcutaneous 1:1000 dilutions. MDA, that is meter dose inhaler of salbutamol 100 microgram per puff. 2 puffs every 15 minutes until relief. Meter dose inhaler of salbutamol 100 microgram per puff. 2 puffs every 15 minutes till relief. Rewrite the prescription. In the format, again you have to write in the format. The treatment injection adrenaline 0.5 mg subcutaneous 1:1000 dilutions. Meter dose inhaler of salbutamol 100 microgram per puff. 2 puffs every 15 minutes till relief. Fourth question. Analyze, correct, and rewrite the following prescription for a case of drug-induced Parkinsonism. Analyze, correct, and rewrite the following prescription for a case of drug-induced Parkinsonism. Levodopa 200 mg BD, levodopa 200 mg BD, bromocriptine 100 mg BD, bromocriptine 100 mg BD, benzotropine mesylate 1 mg OD, benzotropine mesylate 1 mg OD. Criticism. Levodopa, which is a precursor of dopamine, is used in the treatment of Parkinsonism. It is used in a dose of 200 mg BD, which is not effective for drug-induced Parkinsonism. Levodopa, which is a precursor of dopamine, is used in the treatment of Parkinsonism. Here it is used in a dose of 200 mg per BD, which is not effective for drug-induced Parkinsonism. Bromocriptine is centrally acting dopaminergic drug. Bromocriptine is a centrally acting dopaminergic drug. The correct dose of bromocriptine is 1.25 to 2.5 mg OD at night. The correct dose of bromocriptine is 1.25 to 2.5 mg OD at night. The dose given in the above case is very high. The dose given in the above case is very high and it is not effective in drug-induced Parkinsonism. Dose given in the above case is very high and it is not effective in the drug-induced Parkinsonism. Benzotropine mesylate is a centrally acting anticholinergic drug. Benzotropine mesylate is centrally acting anticholinergic drug used for the treatment of drug-induced Parkinsonism. Used for the treatment of drug-induced Parkinsonism. The correct dose is 2 to 4 mg per day. Here the dose is low. So the correct dose is 2 to 4 mg per day. Benzotropine mesylate is a centrally acting anticholinergic drug used for the treatment of drug-induced Parkinsonism. Yet the dose given is low. The correct dose of benztropine mesylate is 2 to 4 mg per day. Drug-induced Parkinsonism is caused by some antipsychotics like phenothiazines. Drug-induced Parkinsonism is caused by some antipsychotics like phenothiazines. There is imbalance between cholinergic activity and dopaminergic activity. There is imbalance between cholinergic activity and dopaminergic activity. Anticholinergic therapy restores this balance between, leading to the relief of symptoms. It reduces the unbalanced cholinergic activity. Anticholinergic therapy restores this balance, leading to relief of symptoms. It reduces the unbalanced cholinergic activity. Correction: tablet benztropine mesylate 2 mg BD. Tablet benztropine mesylate 2 mg BD. Rewrite the prescription in the format. The treatment: tablet benztropine mesylate 2 mg BD. Fifth question. Criticize, correct, and rewrite the following prescription for a case of hypertension with diabetes mellitus. Criticize, correct, and rewrite the following prescription for a case of hypertension with diabetes mellitus. Here it is given propranolol 40 mg single dose, propranolol 40 mg single dose, glibenclamide 20 mg OD, glibenclamide 20 mg OD. Criticism: propranolol is non-selective beta blocker useful in the treatment of hypertension. Propranolol is non-selective beta blocker useful in the treatment of hypertension. It has many side effects because of its non-selectivity. It has many side effects because of its non-selectivity. It can cause severe hypoglycemia when given along with glibenclamide. It can cause severe hypoglycemia when given along with glibenclamide. Drug of choice for hypertension with diabetes mellitus patients is ACE inhibitors. The drug of choice for hypertension with diabetes mellitus patients is angiotensin converting enzyme inhibitors, that is ACE inhibitors. The propranolol is a non-selective beta blocker useful in the treatment of hypertension. It has many side effects because of its non-selectivity. It can cause severe hypoglycemia when given along with glibenclamide. Drug of choice for hypertension with diabetes mellitus patients is ACE inhibitors. Glibenclamide is a potent hypoglycemic agent used in the treatment of type 2 diabetes mellitus. Glibenclamide is a potent hypoglycemic agent used in the treatment of type 2 diabetes mellitus. Normal dose is 2.5 to 5 mg per day. Normal dose is 2.5 to 5 mg per day. Correction: tablet enalapril 5 mg OD. Tablet enalapril 5 mg OD. Tablet glibenclamide 5 mg OD. Tablet glibenclamide 5 mg OD. Rewrite the prescription. When you rewrite the prescription, you should write in the format: tablet enalapril 5 mg OD. Tablet glibenclamide 5 mg OD. Sixth question. Criticize, correct, and rewrite the following prescription for a case of grand mal epilepsy. Criticize, correct, and rewrite the following prescription for a case of grand mal epilepsy. Phenytoin sodium 500 mg TID. Phenytoin sodium 500 mg TID. Carbamazepine 200 mg OD. Carbamazepine 200 mg OD, sodium valproate 200 mg OD, sodium valproate 200 mg OD. Criticism: phenytoin sodium is used in grand mal epilepsy. Phenytoin sodium is used in grand mal epilepsy. Dose is 100 to 400 mg OD. Here the above dose is too high. Phenytoin sodium is used in grand mal epilepsy. The dose is 100 to 400 mg OD. Here the above dose is too high. Carbamazepine is also useful in grand mal epilepsy. Carbamazepine is also useful in grand mal epilepsy and most commonly used for complex partial seizures. It is an inducer of hepatic macrosomal enzymes. Carbamazepine is an inducer of hepatic macrosomal enzymes and causes increased metabolism of phenytoin sodium when given together. Carbamazepine inducer of the hepatic macrosomal enzymes and causes increased metabolism of the phenytoin sodium when given together. Sodium valproate is useful in grand mal epilepsy, but it is the second choice of drug. Sodium valproate is useful in grand mal epilepsy, but it is the second choice of drug. It is a broad spectrum anti-epileptic drug useful in the absence of seizures also. Sodium valproate is a broad spectrum anti-epileptic drug useful in absence of seizures also. The mentioned dose here is very low. The normal dose of sodium valproate is 500 to 1000 mg per day in 2 to 3 divided doses. The normal dose of sodium valproate is 500 to 1000 mg per day in 2 to 3 divided doses. Generally, monotherapy is given in case of sodium valproate. Generally, monotherapy is given in case of sodium valproate. Correction: tablet phenytoin sodium 100 mg BD. Tablet phenytoin sodium 100 mg BD. Again, rewrite the prescription in the prescription format. The correction, you have to rewrite the prescription in the format. The treatment part, you write tablet phenytoin sodium 100 mg BD. The one criticize, correct and rewrite the following prescription for a case of angina with hypertension. Criticize, correct and rewrite the following prescription for a case of angina with hypertension. Isosorbate mononitrate 2 mg BD. Isosorbate mononitrate 2 mg BD. Enalapril 20 mg BD. Spironolactone 20 mg BD. Isosorbate mononitrate 2 mg BD. Enalapril 20 mg BD. Spironolactone 20 mg BD. Criticism: isosorbate mononitrate is used in the treatment of angina. Dose range is 5 to 10 mg BD. It can be increased up to 20 mg per day. Isosorbide mononitrate is used in the treatment of angina. Dose range is 5 to 10 mg BD. It can be increased up to 20 mg per day. Enalapril is an ACE inhibitor which is used in the treatment of hypertension in a dose of 5 to 10 mg OD. Enalapril is an ACE inhibitor which is used in the treatment of hypertension in a dose of 5 to 10 mg OD. It can cause severe hyperkalemia as side effect. It can cause severe hyperkalemia as a side effect when combined with potassium-sparing diuretics like spironolactone, which increase serum potassium levels. Enalapril is an ACE inhibitor which is used in the treatment of hypertension in a dose of 5 to 10 mg OD. Enalapril can cause severe hyperkalemia as a side effect when combined with potassium-sparing diuretics like spironolactone, which increases serum potassium levels. This hyperkalemia may cause cardiac arrhythmias and death. This hyperkalemia may cause cardiac arrhythmia and death. Dose mentioned for enalapril is very high. Dose mentioned for enalapril is very high. Spironolactone should not be combined with enalapril due to hyperkalemia. Spironolactone should not be combined with enalapril due to hyperkalemia. The dose of spironolactone is 25 mg OD. The dose of spironolactone is 25 mg OD. Spironolactone may be used as an adjuvant therapy in congestive heart failure along with the digoxin in some of the cases. Spironolactone may be used as an adjuvant therapy in the chronic congestive heart failure along with the digoxin in some of the cases. Correction: tablet isosorbide mononitrate 5 mg BD orally. Tablet enalapril 5 mg BD orally. Tablet isosorbide mononitrate 5 mg BD. Tablet enalapril 5 mg BD. Rewrite the corrected prescription. The format you write, the treatment you write: tablet isosorbide mononitrate 5 mg BD orally. Tablet enalapril 5 mg BD orally. Eighth question. Criticize, correct, and rewrite the following prescription for a case of acute gouty arthritis. Criticize, correct, and rewrite the following prescription for a case of acute gouty arthritis. Allopurinol 100 mg TID. Allopurinol 100 mg TID. Colchicine 5 mg initially followed by 5 mg 6th hourly. Colchicine 5 mg initially followed by 5 mg 6th hourly. 6 mercaptopurine 100 mg TID. 6 mercaptopurine 100 mg TID. Criticism: allopurinol is a potent inhibitor of xanthine oxidase. Allopurinol is a potent inhibitor of xanthine oxidase. It lowers the serum uric acid levels. It lowers the serum uric acid levels and is useful in the treatment of chronic gout. Allopurinol has no role in acute gout. Allopurinol has no role in acute gout. Normal dose of allopurinol is 600 mg OD. Normal dose of allopurinol is 600 mg OD. Colchicine Acute attack of gout is treated with either with NSAID or colchicine. Acute attack of gout is treated either with NSAID or colchicine. Colchicine is used to suppress the gouty inflammation. Colchicine is used to suppress the gouty inflammation. It is prescribed in a dose of 0.5 mg orally every 3 hours until the pain is relieved. Colchicine is prescribed in a dose of 0.5 mg orally every 3 hours till the pain is relieved. 6-mercaptopurine is a purine analog used in the treatment of malignancies. 6-mercaptopurine is a purine analog used in the treatment of malignancies. It has no role in the treatment of gout. It has no role in the treatment of gout and should not be combined with xanthine oxidase inhibitors like allopurinol. 6-mercaptopurine should not be combined with xanthine oxidase inhibitor like allopurinol. If 6-mercaptopurine is combined with allopurinol, it increases serum uric acid levels, which will further aggravate the acute attack of gout. If it is combined with allopurinol, it increases the serum uric acid level, which will further aggravate the acute attack of gout. Correction: tablet colchicine 0.5 mg initially and repeat every third hourly until the symptoms are relieved. Tablet colchicine 0.5 mg initially and repeat every third hourly until the symptoms are relieved. Rewrite the corrected prescription, the prescription format you write whenever you write. It is in the format, prescription format. The treatment part, you write tablet colchicine 0.5 mg initially and repeat every third hourly until the symptoms are relieved. 9th one, criticize, correct and rewrite the following prescription for a female patient aged 48 years suffering from congestive cardiac failure. Criticize, correct and rewrite the following prescription for a female patient aged 48 years suffering from congestive cardiac failure. Tablet digoxin 250 mg, 30 tablets, 1 tablet to be taken once a day in the morning for 1 month. Tablet digoxin 250 mg, 30 tablets, 1 tablet to be taken once a day in the morning for 1 month. Tablet furosemide 100 mg, 120 tablets, 1 tablet to be taken 8 hourly for 1 month. Tablet furosemide 100 mg, 120 tablets, 1 tablet to be taken 8 hourly for 1 month. Criticism: the dose of digoxin is very high. The usual dose is 0.25 mg once a day. The dose of digoxin here is very high. The usual dose is 0.25 mg once a day. Dose of furosemide in congestive cardiac failure is 40 mg once a day, usually given in the morning, so that the action is over by evening. The dose of furosemide in congestive cardiac failure is 40 mg once a day, usually given in the morning, so that the action is over by the evening. Hence, furosemide 40 mg should be given with the digoxin 0.25 mg in the morning. Hence, the furosemide 40 mg should be given with the digoxin 0.25 mg in the morning. Potassium loss is caused by diuretics like furosemide as well as digoxin. Hence, potassium has to be supplemented. Potassium loss is caused by diuretics like furosemide as well as by digoxin. Hence, potassium has to be supplemented. Corrected prescription: tablet digoxin 0.25 mg, 30 tablets. Tablet digoxin 0.25 mg, 30 tablets. One tablet to be taken once a day in the morning at 8 a.m. for 1 month. One tablet to be taken once a day in the morning at 8 a.m. for 1 month. Tablet furosemide 40 mg, 30 tablets. Tablet furosemide 40 mg, 30 tablets. One tablet to be taken once a day in the morning at 8 a.m. for 1 month. One tablet to be taken once a day in the morning at 8 a.m. for 1 month. Syrup potassium chloride 1.5 grams per 15 ml. Syrup potassium chloride is available in 200 ml bottle. Syrup potassium chloride 1.5 grams per 15 ml. 15 ml to be taken diluted in a full glass of water once a day. Serum potassium chloride 1.5 grams per 15 ml. 15 ml to be taken diluted in a full glass of water once a day. Rewrite the prescription. Again, you write in the prescription format. Prescription, whenever you write the drugs should be written in the capital letters. In the order, the injections are written first, then capsules, then tablets, then syrup. Like the order has to be maintained. Whenever you rewrite the CCR, and the CCR that is criticized, correct and rewrite. Rewrite should be in the prescription format. Here again you write in the format, place, date, patient details, doctor details, prescription. In the treatment, blood digoxin 0.25 mg, 30 tablets, one tablet to be taken once a day in the morning at 8 a.m. for 1 month. Tablet furosemide 40 mg, 30 tablets, one tablet to be taken once a day in the morning at 8 a.m. for 1 month. Then the initial, the registration number or stamp is essential. So the treatment part, syrup potassium chloride 1.5 grams per 15 ml. 15 ml to be taken diluted in full glass of water once a day. After the treatment, doctor initial with stamp or doctor initial with the registration number, date is very much essential, and it creates the genuineness for the prescription order. Thank you for your active listening, and write all this in the records.